All right, welcome everyone to another healthysimulation.com webinar. My name is Lance. I am the founder of healthysimulation.com. So excited to have you with us all here today. Just a little bit briefly about me. I'm kind of your MC for the webinar session here. As I said, founder and CEO of healthysimulation.com. I'm also the founder and an advisor to the board of simghost.org. I've authored over 3,000 simulation articles on the website and those various platforms. I'm also the former director of the Nevada System of Higher Education's Clinical Simulation Center of Las Vegas, a former simulation technician for the LA Community College District, and I trained prior to that as an EMT firefighter rescue diver, but actually my bachelor's degree is in digital media and film production, and so I've worked in Hollywood for a bunch of years before I kind of turned my radar towards healthcare and started this amazing journey into simulation. So we've got a lot of awesome and amazing goals here for us here today. So good to see you, Julie, Anne-Marie, and Michelle, DMP from University of Hayes in Kansas. We've got some folks there from Florida, Michigan, New Jersey, Houston. So excited that folks are joining us from all of the United States. Netherlands, Dervis is here. Hey, Dervis from Medical X. So glad that you're joining us here today. And we still have more people coming into the room. So obviously our goal today is going to be talking about the top tips on starting with healthcare simulation, right? But first, let's think about the problems, some of the problems and issues that simulation might help us to address. So in the United States, medical errors are estimated to provide or cause 220 to 440,000 deaths a year in the United States alone. And the Patient Safety Movement Foundation, of which healthysimulation.com is a media partner with, uses the Economics Global Report from OCED to suggest that this has a $606 billion annual cost with regards to all of the damages done with regards to lost time, the cost of all the reviews, the obviously the loss of life or error to the patient, and all the consequences of healthcare that might mean, litigation costs, et cetera, et cetera. And it's actually the third leading cause of death in the United States. Now, this is, of course, outside of a COVID year. We've had a crazy 2020 to 2021. And so these numbers are a little off because of that. But just in general, year after year, this is just what's been happening with us and for us in the space, right? And so, of course, we've also had a massive problem this year, specifically about COVID, where clinical rotations have been shut down, campuses have been closed, and our ability to train and educate both learners and professionals has been completely stifled, right? And so a lot of programs have started to look and think about remote distance-based simulation technologies and how those can be utilized to overcome these types of challenges now and in the future. I'm going to put a link to an article that I recently wrote called "Why Healthcare Simulation is About to Become One of the World's Most Important Industries." And it talks a lot about, some of these numbers, what's happened with COVID, and why healthcare simulation is now on the map like it's never been before. And it's a really exciting time for the space, because I think that COVID has really accelerated our industry by as much as 3 to 5 years. So kind of furthering, though, just kind of this consideration of the problem that we're facing right now in clinical education. A lot of leading experts in our space, including Dr. Kim Layton, Dr. Susie Cardon-Egren, Dr. Angela McNellis, Colette Foisy Doyle, and as well Elaine Solo, have written this recent review, systematic review of traditional clinical outcomes in pre-licensure nursing education. And this was published in March of 2021. And it's a fascinating study. The conclusion was that no sufficient evidence was found to support traditional clinical models. The scope of nursing practice and patient complexity requires higher order thinking skills, ability to prioritize, and leadership in interdisciplinary care environments. This review raises serious concerns about how nurse educators assess learning in traditional clinical environments. Pretty mind-blowing, because what they were suggesting is that, hey, simulation is put up to this massive bar where it's got to prove itself as worthy of being capable as a utilized source of training. There was the NCSBN National Landmark Study. I believe that took place in 2013. I know Susie was a part of that, as well as other champions that we connect with on a regular basis, which found up to 50% of clinical training time can be replaced by simulation with no adverse effects or any challenges towards the nursing learners. And that was across the entire country with this landmark study. And so I'll find that link for you and put that in the chat room as well here shortly so that you can follow along with that. And a really amazing kind of study that I think is really important to kind of know and review. But it really just kind of goes to show that simulation is put up to this high bar, but really what has been proven in terms of its efficiency and traditional clinical training outcomes. And really these nurse educators are saying, we've got a big problem, right? So just real quick here, we've got a chat room question I'd love for you to kind of put into the answer into the chat box. How are you training and evaluating faculty within your organization, right? In terms of their ability to provide for the outcomes that you determine. And more so, the second question, what is your greatest challenges or barriers to bringing simulation-based education into your clinical education program, right? So as simulation champions, you are new to this field, you're here learning more about clinical simulation for the, maybe you're very new. We've had people that I've met them that like, this is the second day I've ever done anything in my job as a new simulation coordinator, at some of our webinars or events before. And so I know that there's this continual kind of open door of people who need to learn about the space, the technology, the methodology, and the process of how to be successful with simulation. There's entire books dedicated to the operation of simulation. I know I helped to write one with my colleagues from SimGhost, including Dr. Scott Crawford and many amazing champions. We wrote over 400 pages on operations alone, right? And so that's part of the Springer book series. It's another link I need to put in the chat room for you all. With regards to operating simulation-based technologies, an amazing resource. But it really just goes to show that we are probably in the early adopter phase of clinical simulation. And I do believe, and that's in developed countries, I do believe that, again, COVID has catalysted us. And so now we might be on the tipping point of just about early majority. But if you go to that technology adoption curve, that bell curve, we're somewhere at around 10 to 13% market penetration with regards to the technologies and methodologies in the space. Most of that would probably be in an educational modality as opposed to a clinical practice professional training modality, as educators have obviously more access to the technologies and the time necessary to kind of learn how to incorporate simulation and utilize it, whereas hospitals are knocking on that door for profitability and maybe are not seeing the writing on the wall with regards to the preventative. Ounce of prevention is worth that pound of cure, right? So just looking at some of the answers here, / ignorance. Yep, that could be something that's going on. Okay, we see faculty are busy and are resistant to add anything extra to their already full course loads. Understandable. Buy-in funding, training and educators in how to be effectively use and evaluate simulation-based education, or SBE, everyone share with us too. So yeah, the thing about being an early adopter is that you wield this double-edged sword, right? It's great because it's innovative and it's going to have massive change and improvement in your program, but at the same time, nobody wants to join you there, right? And so people who are innovators and early adopters really tend to be kind of those, just as they say in the Moneyball, the first person through the door gets kind of beat up and bloodied a little bit because people are resistant to change, right? And there's a lot of reasons and excuses for that. Some of which, COVID wiped away because now we had no alternative to explore and think and consider some of these options of what would be helpful for us, right? So a lot to think about there with regards to where we're at and where we're at as a whole, and that, you're not alone, right? So if you're here and you're feeling a little overwhelmed by this whole simulation thing, from operations to selecting equipment, to finding the right debriefing model, to educating faculty and staff, finding staff, the right staff, and getting them trained in their ability to operate or utilize these programs, and bringing it all together. Who's going to pay for these things and the budgeting? There's a lot, right? But guess what? You're not alone. There's over 61 people here right now in this webinar, and they're all kind of here trying to learn the same thing. And so we're so excited that you're here with us so that we can get started on these tips and tricks. So what some of your peers have asked with regards to like, what is that question of, challenging us most? And I'd say those results included how to increase realism in our simulations. How do we overcome time restraints when using simulation for training purposes? How do we manage costs and instructor buy-in when trying to implement simulation-based training, or SPT? And how do we retain knowledgeable faculty members? Sorry, that's a typo. Faculty members to help facilitate simulation-based training, right? A difficult process there. Do we hire consultants? Do we send them to specific training? How do we maintain that in an ongoing basis? And so we hope that this webinar is going to help to answer some of these unique questions. How do we obtain the funds necessary to purchase high fidelity equipment? Where can we find new healthcare simulation scenarios? How do we effectively meet the simulation training needs of our large number of learners? And how do we stay up to date on clinical simulation advancements and trends? Well, hopefully you're reading a little bit of healthysimulation.com, but you can see there's just such a plethora of things that are necessary to be successful with simulation. And NACSL, or the International Nursing Association for Clinical Simulation and Learning, certainly a mouthful there, they are the leading resource for nursing educators who are utilizing clinical simulation around the world. And they have put together standards of best practice, yet another link. And I'm going to start writing these down because, holy geez, I've got to give you guys some links here. Book and NACSL, we'll get them in that chat room shortly here. But they provide for standards of excellence, which demonstrate that you need all of these things in order to be successful with simulation. And yeah, it's a lot. And so, how many hats are you going to wear in your program until administration understands that we really need to separate that into technical operations, clinical education, or there's facilitators and that specialized debriefing training and scenario development, as well as we need to add administration, right? How are you coordinating for IPE with multiple institutions or multiple groups coming together, scheduling these rooms, scheduling for repairs with mannequin brands, all this kind of management that's required in terms of overseeing a program to this size, right? And so it's an evolution. And so wherever you are within that evolution, in terms of your knowledge and your base, we hope that this furthers your understanding. And of course, we're pulling a lot of these tips, tricks, and thinking from a new course that we're so excited to be sharing about here today. It's a new 4+ hour CE course with nursing CE contact hours provided by our license to the California Board of Registered Nurses. And it's called Clinical Simulation 101, The Basics, right? So early bird registration is in effect right now. It ends May 19th. I'm going to put a link here to the course page if you're interested to learn more about what this event is at any point. I'm just going to briefly just talk about a little bit about what that is before we go ahead and get started with our speaker and learn more about her tips and tricks on top of some of the things that I've already been talking about here today. So it includes 4 hours of instant access to teaching material, including video, lecture notes, self-quizzes, again, those 4 nursing CE contact hours, lessons from global experts, and we'll talk about those in a second, 2 live Q&A sessions, as well as an introductory sim vendor breakdown, right? And so for those that are able to consider and to register in this next hour, we're going to also throw in a bonus for those folks for 1 month webinar subscription to healthysimulation.com that has over 80 expert webinars that have already been recorded during the last year, during the pandemic, many of which also provide for CE contact hours. And they're covering everything from debriefing to operations to hiring, a lot of unique topics, the latest research, VR in healthcare, and how that helps and supports and where that's all going, as well as a lot of demonstrations from some of the key vendors in this space. Now, you're also going to be receive a bonus of 5 SimLab PDF templates that can help you on your journey in terms of operations and management of your program. So that's the end of my little talk there. I'm going to go ahead and start to introduce us to our awesome speaker, Deb Tauber, who is an MSN RN CHSE, or Certified Healthcare Simulation Educator, and CEN. She is an experienced ED ICU telemetry nurse. She's the founder of Innovative Sim Solutions, our partner for providing this upcoming course. She's an adjunct and nursing professor, simulation program manager, as well as a consultant for emerging clinical simulation programs. She's taught at a variety of nursing and medical simulation related courses, and she's also a big volunteer for the Society in Simulation in Healthcare, or SSIH. So we also have these additional presenters who are part of the course: Dr. Beth Mancini, Dr. Penny Watts, Dr. Paul Frampus from UPMC, Andrew Spain from SSH, Dr. Kim Layton, Christine Gadledge, myself, and Amy Copperthwaite, who is the founder of Avkin. So what are people saying about this course? As you know that you can trust some of the content that we're about to share with you here. John Cram, RN, says that he found the Clinical Simulation 101 course to be an excellent overview of simulation content. It helped him to prepare for the CHSE, or the Certified Healthcare Simulation Educator certification. He's known Deb since 2017 and appreciate her passion as well as her course contributors' dedication to simulation. So we'll see some more praise from some other learners who have already had a chance to take the course as well. So there's 3 main learning objectives. We'll be talking about identifying different types of simulation and experiential learning for clinical practice. There, we'll be talking about describing simulation learning and how it can be applied to pre-briefing, simulation, debriefing for helping learners better understand clinical situations, and applying lessons from this course to utilize when your program is to create real-world experiences for learners, right? And of course, it's going to talk about a plethora of amazing kind of modules that are going to kind of break down the key areas that you all might need in order to be successful with simulation, including history, terminology, accreditation, equipment, technology, pre-briefing, so important, the simulation experience itself, debriefing, operations, training, and evaluation. And again, it's instant access starting May 26th, which is when the course launches later this month, 24/7 online access for 2 months, 2 live Q&A webinars. Those are the dates there, and as well discussion area. And we backed that up by a 30-day money day guarantee. So the listed suggested price is $199, and it includes a bonus presentation by yours truly. I'm going to be talking about an introduction to simulation vendors in the space, right? Like what types of equipment are available or systems that are available, and you know, what are the brand names that you should know about, the key players in the space that are going to be able to help provide you with the tools you need in order to be effective. And remember, we're going to cart before the horse here. We need to identify what we need and then purchase those pieces of equipment, not the other way around. So certainly, again, you can register now, receive those bonus registrations by signing up in this particular hour. I'm going to put that one more time in the chat room, and then we're going to go ahead and get started with Deb. So Deb, if you wouldn't mind taking a moment to introduce yourself, and then we'll move to the next slide, which is the start of your top 5 tips from the course in terms of things that folks need to know.
Thank you so much, Lance, for that lovely introduction. Thank you for everyone for attending. I'm very humbled to have this opportunity. I'm excited to go over the top 5 tips with you. We created this course during the pandemic, and I used to deliver it live when I worked for a large university, and I broke it down into 8 modules, and we can get started with the top 5 tips. And if you have any questions, put them in the chat box, and I can respond to them.
Absolutely, we'll be watching those.
So we're going to begin with the end in mind. What do you want your simulation center and program to look like? How many hours can you use for simulation? For example, I live in Chicago in the state of Illinois, and the state of Illinois, the nursing boards say you can only use 25% simulation for clinical, and it's 1 hour of simulation for 1 hour of clinical. However, in our neighboring state, Wisconsin, the state boards of nursing say you can use 50% of simulation for clinical, and the hours count. 1 hour of simulation counts for 2 hours of clinical. So if you think of that from a financial standpoint and what you're paying your faculty, there's a significant difference. So you need to know what your rules and regulations are. And the second thing, who are your champions, right? Who are your early adopters? We're going to go over stop reinventing the wheel, and then how do you provide sustainment, evaluation, and sustainment of your program? So we want to begin with the end in mind. We want to avoid jumping into simulation without clear objectives. People will they'll get all caught up into the coolness of simulation. I mean, oh, look at that. Did you see that? How amazing this is. And then they just kind of get stuck. So don't start with, we have a simulation lab. What do we want to do with it? Rather, identify your actual or potential problems that you're going to use. as a method to eliminate risk or prevent a problem. So if, say your problem is, you have a problem with medication errors, you might want to focus on medication error scenarios, and Dr. Bailey has a course on that. So if you're in a clinical environment, nursing environment, what are your objectives for your courses? So you want to, once again, identify the problems that you want to solve, create a shared mental model within your organization, and then look for objective ways to make simulation a success in your organization. You want to know that you have a good brand and that people are excited to attend your simulations. So the next thing is, what problems are we trying to solve? Once again, you can do a gap analysis, you can do a root cause analysis. What is so if you're in a hospital, if you're in a school, what's your curriculum? So those are going to be your objectives. If you're in a hospital setting, what are your never events? And can you utilize a never event to create a simulation around? You want to keep simulation focused on the issue, and improved patient safety is always our ultimate goal. And once again, I'm pointing again to Dr. Bailey's course on medical simulation. In our next, who are our champions? So determine resources, a budget, and who are your stakeholders. Find, and I saw in the chat box earlier, like, you have to find your champions and your early adapters. And Lance mentioned that, a lot of times the first person in, they're kind of crucified. So if you are into simulation, help those people, help them be successful, recognize them. We know that in many organizations that, you spend 80% of your time on your low performers and 20% on the high performers. You have to flip that and focus on your high performers so that your low performers will move into the realm and, adopt and adapt. This brings us to our next challenge, reinventing the wheel. Use established best practices that are related to patient safety. Use existing resources. Build on policies and procedures. Train your faculty and build a sim team. Now, within the training, within this course, there's all the different speakers that Lance mentioned, and they can all also be accessed through the website of Innovative Sim Solutions. If you go to the resources section, you can see there what they're saying. So you see, last week, Dr. Susie Egon-Carding added a video to that. So if you go to the website, you can see what's even newer with the NCSBN study. And this morning, the society, SSIH, that are developing the new resources for the tests for the cheese, asked if they could have people use those as references to take their examination. And I obviously humbly agreed that you can have them. So make sure that you, once again, use best practices. Dr. Penny Watts talks about INASCO. Dr. Kim Layton talks about her amazing evaluation tools that she has. So once again, stop reinventing the wheel. And I can see 10 years ago, when I started in simulation, we needed to reinvent the wheel. I'll never forget. I walked in there and they said, Tauber, you're good with peds, so get this mannequin to work. And I'm thinking to myself, I'm good with real kids because I worked in the ER for 25 years. I'm not good with the mannequin. I don't know how to put this together, but I had to figure it out. So I had to, at that point, reinvent the wheel. But now the wheel's out there. So let's just use a wheel. And this course really goes over what some of the opportunities are out there and how do you select the best tool for you. So we'll go into how to complete the course breakdown. Does anyone have any questions at this point?
Yeah, so Deb, just from my perspective, a quick question would be, where's the best place to get started in terms of the energies? Is it the administration? Is the clinical? Is the technical? Or is it with just kind of fact finding for all of it? Where do you think is the best place for people to get started when it comes to simulation?
Well, I think that this is part of the reason that we created this course, because this gives everyone a shared mental model. So it starts out with history and terminology, accreditation and standards of best practice, technology, right? Technology and realism. So what are the different pieces? And the course really breaks out to what all the different things are. And then pre-briefing, the value of pre-briefing. And myself, as well as the goals of innovative sim solutions, we're really big on empathy and making sure that we're including empathy in our training and making sure that we provide that in healthcare, in addition, obviously, to patient safety, which is first and foremost, but making sure that people know that we care, making sure that these clinicians that graduate out of school have a caring attitude. And some of the tools that we're giving away free with this course include making sure that you're noticing that empathy and caring. Lance, did that answer your question?
Sure. And I just want to point out to folks that, again, it's, with regards to cart before the horse in these types of situations, if you're new to the program, are you the individual who's new to a program that's already established, or is this a completely new program, right? Because I think if it's a completely new program, then really you've been tasked that you've been put 16 hats on your head. You might not even know it yet, but if you look up, you start to see, you're operating the technologies, you're scheduling all of the spaces, you're working with other clinical educators to convince them about the power of these technologies. You're working with others to create simulation scenarios or find those simulation scenarios and custom make them to your program. And then you're also kind of overseeing that program outcomes, keeping track of data and trying to understand where the program is going. And all of this while learning, right, about how these things work, how debriefing can be best effectively accomplished, learning about, how to utilize these spaces, how these technologies can be work together nicely or not so nicely sometimes, right? And so also understanding about the structures of staff that other programs have. And so one of the places that I suggest people also start with is when they're kind of getting new to simulation, which unfortunately in the past year has been impossible, is to go to other simulation programs and see what they are doing and kind of take notes, right? And work with maybe perhaps regional collaborative groups like SPOT in Texas, or Simulation Professionals of Texas, or California Simulation Alliance, or in the Northwest, the Northwestern Healthcare Simulation Collaborative, et cetera. There's plenty of kind of regional-wide groups, but unfortunately this past year, the likelihood of them having taken their normal annual event or quarterly event where they bring people together and kind of share different simulation programs has been shut down. But learning from our peers is really one of the only ways to gain access to this knowledge at this point, right? A lot of us kind of sidestep into these roles from other backgrounds. The majority of which would obviously be like healthcare or nursing or others, some type of other kind of clinical practice. But like for me, I came from EMS firefighting, but with an audio-visual background of more than 15 years at that point, 10 years ago, of AV experience. Well, the person next to me could be a paramedic and 20 years of EMT experience. The person next to us, well, she might be an IT specialist with 20 years of IT knowledge, right? And so learning from our peers about how to kind of best cover all those different domains that you kind of mentioned, pre-briefing, the simulation experience, operations, all those things. I think if we all kind of look at who's around us and what their experiences are, we kind of can chip into that and walk away with a little bit more. And so, it's things like this course that are going to help us to accomplish more of that. But at the same time, it's really about understanding where your program is at and where you need to put it in order for it to get to the next level. Because really the buck stops here, right? In a sense. And so if you've been tasked with being responsible for a clinical simulation program, there's a lot of learning that needs to take place. But I think the biggest job that you'll be doing on a regular basis is taking care of bringing this knowledge to other people in this space, right? So they become more aware, and you're kind of a champion for the technologies and the methodologies in a way that helps them to also realize what you already know, which is that simulation is awesome. It can really make an improvement in your program's outcomes, and that it has potential. and there's a lot of different technologies out there that can help with pretty much almost anything at this point, especially with the advent of VR in the last 2 years, I'd say. The new technologies in that space have really dramatically improved. And in terms of hardware and accessibility, right, in terms of cost and performance. So a lot to consider there. Did we have any questions from anyone so far about some particular aspect of starting with simulation? Feel free to put those in the chat. And we're going to continue along here, Deb, with the presentation. I see we have another slide just focused on specifically evaluation and sustainment, which is crucial to consider now at the earliest stages, which is crazy because it's like you already got to be kind of thinking 5 years from now, but that's how you're going to get there, right? By having this master plan. So talk to us a little bit about evaluation and sustainment overall in terms of what we need to be thinking about from that perspective.
Thank you, Lance. And you said a couple things. One, you said, about everyone working together and learning from each other. And one of my favorite quotes is a quote from Stephen Covey, and it's, "When everyone thinks alike, no one thinks a lot." So when you have a group of I'm not saying just anything, when you have a group of nurses or physicians or, IT people, when we get together and we all think together, we think a lot, we think big, right? And I think that one of the important things is that if you think about, okay, this is the way that I explain things when I'm helping an organization. If Lance Bailey wins the lottery and doesn't want to do this anymore, then what's going to happen? Is your shop going to fall down? You want to make your things thinking that it's going to be sustainable, so that when you step away, you want to see your legacy go with that, correct? So build your sim experience based on standardized policies and procedures. And once again, as an accreditor for the society, I really feel passionately about policies and procedures, obtaining leadership, faculty, staff, administration buy-in. I mean, sometimes one of the issues is political, right? You have little camps of, somebody's doing this and somebody's doing that. So you'll be aware of them, evaluate your success, and then look at process improvement. So get together and say, what can we do to process improve? Evaluate everything. And once again, if you take this class and you say, maybe next time focus on this, that, or the other thing, we're going to be very open to your feedback. We like feedback. And then retain your great staff. If you have great staff, do what you can to make sure that you retain them. And I actually talk about it in the training. There's like languages of love, essentially, or languages of appreciation of what the staff member is appreciated by. So for example, some people like praise. They like, Lance Bailey, and then there's some people that like, I would like if you said to me, Dad, I just want to let you know that was a really good presentation. Thanks. You want to know what is gonna be the thing. Some people want money. Some people want, presents. Some people want. So find out what they're.
Or a title. Some people want a title.
Yep, you got it. Perfect. Yep. So retain your great staff because that's really important.
Absolutely. And one thing that you brought up there, Deb, that I think is kind of an interesting perspective and way in terms of how to think about maybe setting up your simulation program from the very get-go to be successful in the long run. And we'll speaking about professional development for us as professionals in a moment, but just with regards to the program success, if you think about it like a franchise, right? Think about it like a Starbucks. You could go to any Starbucks in the world and you're going to get the same experience or almost the same experience. There's a specific way we move through the building in terms of ordering and picking up our coffee. And there's items on the wall that are always kind of specifically placed in terms of sales opportunities, the way that the chairs are laid out, the amount of times that the room is kept clean and the bathrooms are cleaned, the hours of operation, the number of staff, depending on the day of the week, and the training that they need in order to be successful at either managing the register or managing the drive-through or managing the coffee production itself or managing the space. And what are the roles and responsibilities of all those folks, right? And so if you think about it in terms of that kind of a concept, that gives you permission in your mind to create a structure that is a business in a sense, right? Because no matter who walks in the door, for clinical learning outcomes, whether they be a doctor, a resident, a nurse, a PT specialist, whatever it is, they are going to come through that experience. They're going to gain some kind of level of knowledge, understanding, experiential learning opportunity. They're going to complete some forms for debriefing process and kind of what their perspective was of the event. And then they're going to leave, and we're going to set up everything and get it ready again for the next customer who comes in the door, right? No matter what that particular person is. Now, obviously, we've got to schedule these things. We can't just do it willy-nilly whenever we want. But the concept of building a space out and a program out that is ready to be able to basically process requests for utilization, equipment pulls, scenario development, and then actual execution of the learning environment and the experience, and then to wrap up the debriefing, the technological changes that need to take place, the simulation experience, and then move the program forward in terms of program evaluation over time, right? And so if we can think about this perhaps like a business in a sense where we need to be efficient in this ongoing process, that gives us that permission to step back and say, okay, listen, we're probably going to need some policies and procedures here. We're going to probably need a way to organize the entire structure and flow of this program so that it can be successful in a way that it's modular, just as you said, right? Because if your simulation center director quits or more than likely is hired by another institution because there is so much demand for simulation staff out there, if you're willing to relocate, I'll put that little caveat just because, there's only a few programs per city at this point, but there are plenty of cities in the world, and there's a lot of programs that are figuring out that simulation is going to be the wave of the future. And so, yeah, there's going to be a staff rotation that you're going to need to deal with. Well, why not have a standard operating procedures per position that person is responsible for updating weekly or even monthly, depending on how complete that document is, explaining what their roles and responsibilities are so that when that person does leave, that the program doesn't fall apart, right? It's not a house of cards. It's a house of stone. It's a house of brick, and it's going to be there regardless of the people that come and go within the space, right? Same thing like Starbucks. We can replace the cash register person. It's their 15-minute break. Somebody can jump in and take that over right then and there. Or if we need to find new staff as the program expands, right? We can then find the place for those people, create the job structure necessary for them to be effective in their role, and give them the training initially that they need to be successful because we've got some documentation going on. Well, yeah, that takes a lot of time and effort to build, right? And so I think one of the most important things that we're going to be talking about in this course and also here today is the amount of administrative buy-in that you and your program have is crucial. Right? Because when I was the director of the Clinical Simulation Center for the Nevada System of Higher Education, we had 2 nursing programs and a medical school all under, the Regency there as public institutions. But this was the first time that they were ever coming together on one singular space to do specialized training together. Prior to this, they'd all done it on their own individual campuses. Well, now we have this joint facilities funded in part by the state, right? And so it was about, we got to come together and play nice. Well, that took some time and effort to bring those people together in a way and create the policies based on faculty feedback to train those staff, get those folks up and running. It took about 2 years, let's say, from start to finish. And I think there were plenty of things that we could have done ahead of that time to really better prepare ourselves into that transition. And so hopefully what we're going to be able to do in this course is to share some of that knowledge and experience with you all so that you can better hit the ground running with regards to a program development. And then let's also just talk about professional development as us as simulation professionals, right? Deb, will you kind of give us some insights into how we kind of need to think about our own professional development, since there are so few educational degree pathways? There's a handful out there. Like we're sharing about the Drexel Masters in Simulation program on healthy simulation right now. But what other ways outside of these, there's probably about 10 programs out there that have a degree program. What other ways should we be thinking about our professional development?
That's a great question, Lance. Thanks for asking that. And I think some of the things that we see with accreditation is when programs are going for accreditation, that's one of the questions is, how are you training your staff? How are you keeping them within learning, continuing to learn? And you can do lunch and learns, you can have someone do a presentation, you can certainly reach out. There's so many people in the simulation community that are passionate about helping others. I mean, when I reached out to people to do videos for me, they were so, I was just so humbled to have them. In fact, Chad Epps was going to do a video for us before he died, unfortunately. But I mean, the community of simulationists want to give. We want to make healthcare a better place. So I think, you know, once again, looking for resources, reaching out to people, having them come in for lunch and learns. We will get back to conferences at some point, right? One day we will get back to conferences. So those are some of the things that you can do to continuing education. And then once again, taking this course would, so if you're going, if you have your CHEES, your certified healthcare education certification, and you need to say, how did you complete the hours? This 4-hour course would count for those hours, right? If you're working towards standardization and certifications.
Right, absolutely. Certifications certainly are a great way. Even accreditation of your program could be this master plan step of how to achieve that accreditation. There's, you know, accreditation from the ACS, but also SSH as well internationally. So like CESAM or ASPE, I think even Simulation Australia, they have regional accreditations. And what's great about those things is that they are free, usually the outline plan of like what the requirements are. And what's great about that is that you can totally lean on those to help build your program up. And maybe, you know, accreditation is a 2-year plan from now, but it's okay, we need to have these 10 things in place by that point. And it's just a great guide for us in terms of what we need to do to get our program ready. But again, with regards to that professional development, I think, you know, at this point in the industry, in the community, it's learning from peers. It's potentially a degree program if you have access to those resources and the time now to be able to accomplish that, of course, in the prereqs, depending on what your previous background in clinical or educational experience is. You know, I know, like, for example, some SimTechs only have an associate's degree, and so they're not going to be able to go for those master's degree programs. It's courses like this, right? It's by specialists in who have gone through many doors and bashed through and built step by step out in the frontier, a little log cabin. We understand what it takes to kind of be successful enough. And we want to invite you all over and say, hey, here's what you need in order to do to skip many of the headaches that we have learned from, right? And so this is with your experience and mine, this is probably 20 years of knowledge that we're trying to bestow upon those that are new to the simulation space, because we would much rather save you from all those headaches and get you to a place where you're more confident with the technologies and the methodologies so you can be more successful with your programs, right? Because that's really what we're passionate about, is seeing that success and seeing the success of simulation expand across the world of healthcare as best as possible, just like it is with the aviation. You know, 50 years ago, I was talking to Captain Jack Drapier, who is one of the training consultant specialists for Airbus. And I was at the World Aviation Simulation Training Symposium, WATS, from Halldale Media, and they do they're like the leaders in aviation simulation training for a commercial airline. And he was talking to me about his 70 plus years of experience in flight. And he said maybe not about 50 years, I guess now, yeah, in 1960s, he suggested, like, none of the pilots wanted to do the simulators because they weren't realistic enough. Well, cut to today, right? Look at how well those systems have evolved to the degree that they are now, where they're extremely realistic with the hydraulic simulators and the computerized screens and the full encompassing cabins where pilots can really train at facilities that, like, companies like CAE or Canadian Aviation's Electronics, I believe it is, who have a massive presence now in the healthcare space. Well, so 50 years ago, we didn't have simulation-based training for aviation. We didn't have CRM or crew resource management, which today we would call in healthcare the team steps model, or from AHRQ. And they didn't even have black box technologies. Well, all of those things have obviously changed. And by the late mid 1980s, everyone was completely bought into all of those things. And now flight is one of the safest industries in the world. You remember last year, those 2 unfortunate 737 crashes. Well, guess what? Those crashes made the entire world shut down the 737 MAX. 2 crashes, 2 incidents. Can you imagine what would happen in healthcare if 2 medical era deaths shut down a procedure across the world because we really needed to make sure that this was safer for people in the future? It's just mind-boggling to think about the differences between where aviation is and where healthcare is going. Okay, so with that, Deb, I know we're kind of coming up on the tail end. I would just think it would be great if we could go through and you could share a little bit about what's going on in each of the lessons that we had talked about, these 8 different modules, to kind of prompt some other kind of tips that would help people to kind of think about what they need to know about now with simulation as we kind of take a closer look at the course itself. So I know we've got the course overview. It's going to be the introduction, some of the, welcomings and key information there. But let's talk about module 1. What's going on with history and simulation and terminology?
So history and simulation and terminology, we go over what the sim dictionary, the history of simulation, how and when it started. There's a little video clip from the office fire drill so that people remember that, the PowerPoint is boring. It's just kind of a fun opening module, and that one is 18 minutes.
Okay.
Then included in that is the video transcript and slide notes. And then there's a module self-quiz, like a quiz that's 5 questions, and you have to pass through them to move forward to module 2. Module 2 is accreditation and standards of best practice. Now, I am going to say this module is 37 minutes. It is the longest one. And it's long because Kristen talks for 13 minutes about accreditation and about how doing accreditation, going for accreditation helps to get everyone together working. And Andrew talks for, I think, 8 minutes about certification. We have Dr. Beth Mancini, who talks about the simulation book. And we have Dr. Penny Watts talk about ANASCL and the standards for healthcare simulation for ANASCL. In module 3, we get into equipment and technology, and it's just simple, where we go over, what's like, there's times that I'll be called to do a consultation and I'll say, do you have simulators? And they'll say, yeah. And then they say, well, what kind? And they don't know what they have. So sometimes I'll say, well, let's take our phone and let me look at them. And then, oh, that's Noel. Oh, that's, SimNan 3D. So it's about just like, what is the different equipment and technology so people just better understand it. And then module 4.
So just a quick note about that module 3, equipment and technology, Deb. I think what's important to note there is that we should not be using an $80,000 mannequin to do IV starts and practice, IV practice, right? Yep. Let's buy a $250 task trainer, $500 task trainer, $1,000 task trainer to do that role, where we're going to have multiple kind of learners come through, learn a specific skill set, and move on to the next thing. Well, let's reserve the really expensive mannequin, the really expensive room, the audio video recording systems for those higher stakes training environments where we might have IPE or like a full lecture plan. But let's not do that. Let's not use that mannequin for basic training, right? And so just kind of also identifying in that module about like what the appropriate kind of selection is based off the need first, then you pick the tool, right, that we need to go through. So really an important thing that we really go into in depth there, I know. Okay, yeah. Module 4.
Thanks for that. You nailed it. That's exactly what we talk about is, if you're a nursing program and you're never going to need to intubate a patient, why do you, what is the need for that? But, if you're going to have, do some of the high risk obstetric stuff, you're going to need a birthing simulator, right? Module 4 is technology and realism. And we talk about the different AV platforms. There's Beeline and SimCapture and Learning Space and the different platforms. So what they are and how you would select the best one for your program. And then some of the technology and realism. This one is where Amy from Avkin talks about some of her, some of the standardized patients. And then module 5 gets into the value of pre-briefing. And I believe that in the past, people have stated all the learning occurs in the debriefing, and that's just not true. So the value of pre-briefing, we talk about how important it is to go over everything and so that your learners feel comfortable when they get into the simulation. And that's one of the bonus gifts is that we have the pre-briefing checklist that you can customize for your center. And Cedars-Sinai actually uses that for Cedars-Sinai, which is the big program in Hollywood. And they used it for their accreditation, and Russell gave me permission to say that, you know, they're using it and they like it, and it's good. It goes over just like in the airline industry when you say, you know, when you get on the airplane, they say, you know, here's where the exit doors are, the oxygen's going to come down, here's where you do this and that. And so it goes over the importance of pre-briefing in simulation.
And I just want to clarify that pre-briefing is slightly different from orientation, right? Orientation is probably something that needs to be done at the beginning of the day for the learners, to the environment and the technologies that they're going to be working with, so they can better understand, you know, how to feel for the pulse and do the pupils dilate on this particular mannequin. What are the technological features or things that they might need to know about? Where are the O2 masks? Let them play in the environment in the room. One of the things that we love to do with the audio video production background that I had at the CSTLV was we recorded some of these orientations and made them prerequisite requirements before learners came into the space. They had to answer a little quiz online after watching this video. Where are the O2 masks in the emergency department simulation lab room, right? And so that just gave them a digital kind of introduction. And so then when they came in to do their physical orientation, so obviously prior to COVID, that they were able to already kind of have known the space and seen the space before. So now it was solidifying that. So by the time we got to their learning, you know, engagement that afternoon, the particular learner would come in for being the primary learner, and they would already be somewhat acquainted with the space. It wasn't kind of like overwhelming that they had to deal with all that on top of the clinical outcomes that we were hoping for them to perform, right? And so I think it's just really important that we identify that the pre-briefing is something that's going to happen as a huddle, both as team members and learners, in introducing everyone to the particular learning experience that we're going to be having and any unique pieces of technology that we need to know about. But for the most part, we're introducing the space in the orientation, which is also really important. Okay, so let's move forward from there to module 6.
Module 6 is simulation the experience, and it's only 9 minutes. It's a short one. And it just goes into, like, if someone doesn't understand what simulation is, it gives you some touch points for what it is and guides you to what the simulation experience could look like. And then module 7 is debriefing. And this is the one where we have Dr. Frampus, and he talks about debriefing. And then I go over just some different models of debriefing, just to give learners a feel for what different models are out there.
Okay, great. Yeah. And so many different models out there. There's probably at least, you know, 15 to 20, but there's probably about 5 that are used primarily, but a lot of different interesting kind of considerations there with regards to like why you might use one or the other, and what are their main purposes for, and what are their strengths and weaknesses in terms of, you know, a tool, and which one do you just like the most? You know, I think it's about being comfortable with something when it comes to simulation in terms of that it makes sense for you and your program. Okay, so the last ones we got here, module 8, what's that all about?
And module 8 is about training faculty and evaluating your program. And this is the one that you graciously provide some information about, you know, how you're going to do some things within your simulation center, as well as Dr. Kim Layton talks about evaluation, formal evaluations. And she has done so much amazing work in evaluation. And so, you know, she talks for a couple minutes about her experience. And then the bonus materials we have, which we'll show you. And then the certificate of completion, you have to do, you want to talk about this, Lance?
Yeah, so we've got the bonus learning materials. I'll just cover those in a second. But the certificate of completion, that's where you're going to be able to complete these forms of our feedback that are required by the California BRN. Also just kind of providing us some feedback for the course. And then you can download that certificate. We'll have that online for you. So it's very easy for you to be able to secure that CE certificate for participating in the course, which you have access to from the moment that the course launches. So just briefly, just taking a look at some of the course complete course breakdown, bonus materials for signing up during this hour. You're going to get 1 month of healthysimulation.com webinar service complimentary access. I put a link into the chat so you could kind of see some of the 80 plus webinars that we already have pre-recorded or recorded over the past 10 months, and more coming every week. We've got also these 5 awesome checklists, templates that are helpful for you and your program in terms of taking to the next step. So you want to just briefly go through these. I know we're coming up to the end of this hour here. Again, folks, if you have any questions about, you know, how do you be successful in starting in simulation, let us know. But let's briefly go over the pre-briefing checklist, a student eval for QSEN, ISBAR, faculty form evaluation tool, and a SimTech job description template, which I think is pretty awesome too. So you want to just talk about these real quick, Deb?
Sure, sure. So this is the checklist that I was explaining earlier. So if you have pre-work, go over it with the learners. You're going to talk about expectations, how long things are going to be, acknowledge your physical safety as well as psychological safety, review the fiction contract. I know that this isn't real. You know that this isn't real. I know that you know that. But confidentiality, you can't take pictures, what your video policies are within your organization, role assignments, and then consider having a safe word. So say your objective is healthy communication for between two patients, and the mannequin flops and then is non-responsive, and the learners think, oh my gosh, do I do CPR? So you might want to have a backup plan for, you just want to stop there and have a safe word. So that's that item. Go ahead for the next one.
Okay.
This is an ISBAR tool, so you can have a patient handoff communication tool that learners can use from introduce yourself, what's the situation, what's the background, what's your assessment, and what's your recommendation, so that learners can learn to use the ISBAR communication tool. Next.
Okay.
And then this is QSIN. So if you have, it's quality safety in nursing education. And it's, if you have people that are observing in the observer role, they have something to look at and to take notes with, so that when the group gathers for debriefing afterward, they can say, I witnessed patient-centered care, I witnessed teamwork and collaboration. They can point to those things so they have something to be focused on within the simulation. And then the last one on there is, I observed a caring behavior during the interaction. Comfort measures such as privacy, cleanliness, some kind of a caring behavior. Next slide, please. And then this one is a bonus item, which is a formative faculty evaluation. The clinical instructor, and it's just it's benign. So it's not really, to help them just a little bit. The clinical instructor was on time, they were prepared, they were appropriately dressed, they were acknowledged the psychological safety of the learners, but it's something that you could get started with if you want to. Once again, I am absolutely not the leading expert on evaluation tools. That would be Kim Layton. But some of these things are, are available.
Absolutely. And then I've also included here a SimTech job description that we had put together. And so having been a SimTech and hired SimTechs and founded SimGhosts, we put a lot of knowledge into this. This is the more experienced SimTech, so not your entry-level SimTech, but someone who's really going to be able to help facilitate a program effectively. And so that is included as well with regards to the material. I'm also going to do a vendor breakdown, right? Talking about some of the vendors you see here, the products and the tools that they offer, and just kind of learning a little bit more about it. This particular portion of the course does not provide for any CEs, as obviously it's really all about the vendors, but certainly, very helpful to kind of better understand some of the landscape and get an idea of some of the technologies that might be available to you. Again, not that you want to go out and buy all that stuff and then figure out how to make it work. You want to start with figuring out what you need to do and then purchasing those things. But knowing what technologies exist will help you to determine and understand what kind of things you could bring to your simulation program, right? Maybe some of your clinical partners are saying, oh, it'd be great if we could do this or that. And you have a knowledge about what's available out there. Like, actually, there's a product that does, eye simulation or MRI simulation even, or whatever it is that you really specifically need to do in your program or what others might need to do. And so being aware of what's out there is really helpful, just so that you can make sure to be able to address those needs, those clinical training needs when they come up, right? So just a little bit more praise here from some of the learners that have taken the course already. Billy Pascal, a good friend of mine, says, as I'm transitioning into a new role in the healthcare simulation industry, this course was a great reminder of the basic things I had forgotten. I would encourage this course for someone new to sim. Renee Norberg, MPA MSN, a director of clinical resources at Orbis Education, suggests that she thought that the program was good for beginning simulationists, and she loves the video inserts by the experts to augment the concepts of the summative knowledge. Check at the end of the videos. Great program, says Mary Schultz, clinical lab specialist at Chamberlain College of Nursing. The modules were concise and relevant to objectives. The exam questions were all written well and reflected material presented in each module. Thank you so much. So excited to see all that. So again, we're going to provide all access to all those things that we have listed and explained about. The suggested price for this course, which is when early bird ends on May 19th, is going to be $199. However, now at this moment, it is only $147 to register for the course. So certainly a great discount for participating and all access to all of these materials and this knowledge. I'm going to put into the chat room here one more time the link to the course itself. I'll put that right in here. If we put that here, that's the direct page link. And so, yeah, so only for 147, that's that price is ending May 19th. That's when the early bird shuts down, just about a week before the course launches. You're going to get instant access to 4 hours of expert content, presentations from leading experts, 2 live Q&A sessions to answer and address all your questions, 2 months of access to the materials 24/7 from anywhere that has connected to the internet. And again, for California Board of Registered Nursing CE contact hour certificate, we went with California for our registration because we've heard from a lot of nursing educators that California CEs are accepted by most states within the United States. And perhaps that's something that you can use outside of the United States, but certainly you can have access to the certificate to show your participation. And that 1 hour vendor breakdown from myself with the note about these bonuses. Again, number 1 month of webinar subscription access starts also on May 26th. We've got over 80 recorded presentations from some of the world's top experts. Some of the presenters that Deb has suggested are a part of this course have entire webinars on the platform already. So certainly something to check out there. And then those various bonus materials, I think we only have 3 of them listed here, but they are available there. So let's just wrap this up with any final questions. I see one here from Antonio regarding data collection and staff compliance. I foresee the evolution of healthcare staff training taking a similar path to what occurred with the change from hard copy patient records to electronic records. Do you foresee the same, Deb? And how does the current plan for management of SIM program address this in a non-academic environment?
Absolutely, absolutely. We know that data drives decisions. So in the webinar, in the presentation, I met with Dr. Jamie Robertson, and she's over at Harvard, and they use simulation, and they did a study. Todd Gawande was a part of it. It was $250,000. And what they did was they were able to demonstrate that using simulation for their anesthesiologists as well as their surgeons resulted in much less error. So then they were able to provide a 10% reduction on their medical malpractice insurance. And Harvard is self-insured. So absolutely, data metrics is crucial. What gets measured? Yeah. Thanks for asking about that. All right. Any other questions? Thank you so much, Lance, for this opportunity, and thank you everyone for attending this webinar. It's been an honor.
Yeah, absolutely. One final question came here from Wendy. Has anyone from Canada had yet an opportunity to register for the course or participate?
2 people from Canada have taken the course. I met with somebody who's got a website. Please forgive me, I went through a whole lot of things. I had surgery, and then I had my sister-in-law died. And so I went through a lot of things. So I can't remember off the top of my head who the gentleman was. He has put our website on his website. But so people in Canada have started to take it. And it was at a big Canadian system.
Okay, great. So yeah, so here's the website where the course information is shared about all the things happening here with the event itself. Some examples: the 30-day money-back guarantee. If you don't like it, just let us know. We'll refund your money. We want to make sure that you really do feel that this is helpful to you in your program evolution. And then just to show you behind the scenes a little bit about what this all looks like, here you go. You can see here as I just kind of move through the materials on the course, we can look at the quizzes, the modules, the videos. It's all easily kind of available to us on the left-hand side if we want to navigate through any particular section and learn more about that, but it includes a complete transcript as well as all the slide notes. So as well as a quiz per module, and then the bonus materials. So there's a lot there to it. Really simple. If you have any questions or needs with regards to, anything to do with clinical simulation or the course or this webinar, please feel free to email me, lance@healthysimulation.com. I'm going to put that into the chat. I know we've gone over the hour. I apologize about that, but I thank you all who stayed with us towards the end and really appreciate, your presence here. And I'm excited that you're participating and learning more about clinical simulation, getting started here. We want to be your support anchor and your structure so that you can move forward further, faster than we ever did, because we are so excited about your success in this world, because it's such an amazing tool and we've seen what it can do, and we want to share that experience with you and your institutions. So thanks to everyone for participating. Thank you, Deb. Any final notes or feedback for us here?
No, thank you so much. I guess somebody just texted me that the people are having problems registering, so I just wanted to let you know that, Lance.
Okay, yeah. So I heard one from someone and they had an email issue. They'd already had their email account, but they forgot the password. So if you have any questions, feel free to email me again. I'm going to put my email in the chat room here, lance@healthysimulation.com, if you have any issues. But I know I can see people are registering right now. So certainly I think it's accessible. It's just perhaps there might be some technical issues. So if you have those, please feel free to email me. We'll get them worked out right away. But with that, we're going to wrap this up. Thank you, everyone. And we look forward to seeing you all May 26th for when the course launches.
Thanks, Lance.
Okay, cheers, everyone. Bye-bye.